Some Hollywood stars turn to Botox to wipe away any wrinkles without surgery.
But now we've discovered some new wrinkles in the war against aging. But for those like graphic designer Diane Jenkins, who went absolutely no cutting, there's a new ThermaCool Facelift.
It's non-invasive. I can go in, get it done, and go home and cook dinner. Because to do so, I feel like I'm too young to go in for a facelift.
Diane went to Dr. Grant Stevens for the $2,000 to $3,000 procedure. ThermaCool uses radio frequency waves, which tightens the skin and creates new collagen.
It doesn't take the place of a traditional facelift, but it does postpone the need of a facelift.
The doctor has even had the treatment himself.
It feels like it's very, very warm, and just when I thought I couldn't take it anymore, it gets cool again. So you get the sensation of heat followed by intense cold. I've actually had 2 of them done.
It's amazing. It's even better than I thought.
Coming up next, the laser bra.
I'm a little bit nervous.
How to have a breast lift without the implants. Nikki Ziering and talk show host Jenny Jones are just some of the stars who admit they've had breast implant nightmares. But that hasn't kept women across America from undergoing breast augmentation. Well, now we've uncovered a new procedure that promises a perfect breast without implants. Meet Christine Crowder. The attractive 37-year-old wife and mother of 3 has always had a bountiful bosom.
I actually, before children, was much larger busted than I am now, and after nursing 3 babies, I've thankfully gone down, but I'm still really uncomfortable with being large busted.
Last year, a friend of Christine's paid a visit to Dr. Grant Stevens. Inspired by her pal's results, Christine scheduled a consultation at the surgeon's Marina Del Rey office.
What are your goals?
To have my breasts lifted. I would like them to be a little bit smaller, but I would really, more than anything, like them to be lifted and to be perkier, more youthful.
Okay.
Over the last 6 years, Dr. Stevens has performed over 400 surgeries using the laser bra technique.
With the laser bra, we can do a breast augmentation, a breast lift, or a breast reduction.
Patients have been traveling from all over the world to take advantage of this revolutionary procedure.
In the laser bra, we use skin that is otherwise discarded with traditional breast lifting procedures. But what I do is I treat the skin with the carbon dioxide laser, which tightens the skin and removes the outer layers. It's this skin then that is preserved and used as the internal bra, which supports the breast, lifts the breast, and gives the breast lift a perkier look, a more long-lasting lift, and a more pleasing appearance.
I'm a little bit nervous.
Christine opted to have the operation, and E.T. was there.
What I'm doing here is marking your breast and determining the ideal height of your nipple. The new nipple height will be right here. We'll not remove the nipple. We're going to move the breast up and move the nipple up with it. So this is the area of extra skin that you have.
That's the area Dr. Stevens will treat with a laser. He will transform the skin into a custom fabricated internal bra that is affixed to the chest wall and holds the breasts.
I don't use any sutures on the outside. They're all buried and underneath the skin, so there's no suture removal. There's also no scarring from sutures because there are no sutures on the outside.
A little over 3 weeks later, E.T. joined Christine for her post-operative checkup.
Okay, the nipple height here is perfect. Here's the same.
She admits she has experienced some pain, but the results far outweigh the discomfort.
How do you like your new breasts?
I think they look great, and so does my husband.
Well, good. If you're both happy, then I'm happy.
I'm very happy with the results. First time I really looked in the mirror and thought, wow, I look really great. I don't think I looked this good when I was a teenager, so I'm very pleased.
Today, thousands of women a year are taking advantage of the advances in breast surgeries. But some stars know firsthand the risks of past procedures, leaks, scar tissue, and infection. Former Price is Right hostess Nikki Ziering's experience was a disaster.
I had to have a couple surgeries because I had an infection and I had, I bled internally and, almost died once. I went through a lot of really awful things.
Pam Anderson discovered she had a problem when she decided to have her implants taken out.
When I did remove them, when I found a
leak in one side. But that was, when I took them out, I had no idea anything was wrong. I don't know when that happened, but I'm just glad I took them out.
Scar tissue caused talk show host Jenny Jones' breast to harden. And after her removal surgery, she spoke out about the perils of silicone implants.
I had 5 different sets of implants, a 6th surgery because I had internal bleeding one time. When I look back, I still can't believe that I did all that for nothing.
But Dr. Stevens is one of 15 doctors in the U.S. taking part in an FDA-approved study of a silicone implant that has been widely used in Europe for about 10 years. It's affectionately called the Gummy Bear.
The nice thing about the cohesive gel is that the implants are semi-solid. They're not a runny liquid, so that if you were to cut the implant in half, it would stay together like a gummy bear.
Dr. Stevens' patient advocate, Charlie Sheridan, has gotten the new implant.
Well, I started out originally with saline implants, which were nice, there's no doubt about it. But the moment you feel these, they speak for themselves.
Besides looking and feeling more natural, there is less rippling and virtually no chance of rupture or leakage.
I know I don't have to wake up and worry about being lopsided one morning, not to mention these look so much better.